Hello, and welcome to Power Up, your weekly boost of training, sponsored by the International Sunday School Department of the Churches of God in Christ. And I'm your host, Field Representative Patty Johnson. On today, we like to give honor to our international presiding bishop, Bishop J. Drew Sheard, our international president of Sunday School, Bishop Alton Gatlin, and our director of the Virtual Learning Institute, Vice President Althea Sims. We are live here on Facebook and YouTube every Tuesday at 11 a.m. Pacific, 1 p.m. Central, and 2 p.m. Eastern. So please like and share and give us your comments and questions on today. Today, we are blessed to have our own Assistant International Sunday School Field Representative, Evangelist Charla Johnson. She serves under Bishop Alton Gatlin and Mother Cleolia Penix, who is our International Sunday School Department Field Representative. Outside of working with the Church of God in Christ, she is a licensed and certified ear, nose, and throat physician assistant. She presently manages treatment and care in a community ENT medical office in Portsmouth, Virginia. She is a 23-year career physician assistant certified who has worked 13 years in internal medicine and urgent care and 10 years in ear, nose, and throat. She enjoys teaching biblical and medical information along with volunteering and coordinating logistics within her community, giving COVID-19 vaccines on the weekend. She has a master's degree in healthcare administration, a master's degree in theology, and a bachelor's degree in physician assistant science. Won't you please help me welcome Evangelist Charla Johnson as she presents us today, distinguishing heart conditions from stomach aches. God bless you.
God bless you. I'm excited to be able to talk about this subject. It's very important. One of the things that I do, I work at Chesapeake Bay Ear, Nose, and Throat in Portsmouth, Virginia, which is the Churchland area. And we do things with the gastroenterologist. We do things with cardiologists. And so I wanted to make a distinction with some of the issues that occur with heart disease versus stomach issues. So what the title we will be talking about is What You Don't Know Can Hurt You. What you don't know can hurt you. So I want to talk about what's lurking around in your body. Before I start, I do want to make a plug saying if you have not been COVID vaccinated, please get COVID vaccinated. All right, let's start. So the first thing that we're going to talk about is cholesterol. Cholesterol is a waxy substance that's found in the blood vessels. And you can see, as you can see, that yellow substance there is cholesterol. But the body needs cholesterol to build healthy cells. So its use for cholesterol is good, but if we have too much of it, it causes a problem. There are two different cholesterols that you need to look at. So when you get your lab results back, you'll see HDL and you'll see LDL. You'll also see something called triglycerides. And in one of the slides, I'll be able to explain to you the differences. The high cholesterol, or the HDL, high density lipid cholesterol, that's good cholesterol. So when those numbers are greater than 45, it needs to be definitely above 35. That's a help or protection, or serves as a protection for your heart. The LDL is the bad cholesterol, and you will see that on your lab forms when you get your annual physicals. And if you're on cholesterol medications, they will do that every 6 months, 3 to 6 months. So your LDL is considered bad cholesterol, and it contributes to that fatty buildup that you see, the thick yellowing there. That's what makes atherosclerosis, or what we hear our grandmothers say, hardening of the arteries. Move the slide. I want to give you a video that talks about how the heart,
vessels
the blood
containing
flows
blood
through the
flowing
heart.
to the heart, while arteries have blood flowing from the heart. The blue is representative of blood vessels containing deoxygenated blood, while the red blood vessels have oxygenated blood fresh from the lungs. Now, let's follow the path of the blood through the heart. The superior vena cava receives blood from the head, neck, upper limbs, and chest. Meanwhile, the inferior vena cava receives blood from the trunk, viscera, and lower limbs. Both the superior and inferior vena cava end up in the right atrium, one of the 4 chambers of the heart. The heart not only has 4 chambers, it also has 4 valves. The purpose of the valves is to keep blood moving in the right direction and not flow backwards. Blood exits the right atrium through the tricuspid valve, so called because it has 3 flaps, and enters the right ventricle. The blood exits the right ventricle through the pulmonary valve and enters the pulmonary artery. Again, it is an artery because blood is flowing away from the heart, but it is blue because it lacks oxygen. The pulmonary artery then splits into the left and right pulmonary arteries, which go to each respective lung. In the lungs, gas exchange occurs. The blood discards carbon dioxide and picks up oxygen. Now, blood comes back from the lungs through the pulmonary veins, entering the left atrium. Next, the blood is pumped into the left ventricle through the mitral or bicuspid valve. Finally, the oxygenated blood leaves the left ventricle through the aortic semilunar valve, entering the aortic arch. The aorta, which is the largest of all the arteries, distributes the oxygenated blood to the rest of the body. The aortic arch has 3 major branches, which supply the head and arms with blood. Then the aorta curls downward behind the heart, forming the descending aorta, which descends through the chest and continues down through the abdomen. In the abdomen, the descending aorta splits to supply the pelvis and legs with blood.
If you like this video, please like and subscribe.
The point and purpose of showing that video was so that you could understand how the heart works, how it pumps out, and what we're talking about is there's several different heart disorders that you can have. That would be a lot more time than I can talk to you about. But I wanted to talk to you about strokes, heart attacks. And so you needed to know, one, about the cholesterol. You also needed to know how it flows. You can see how the heart pumps out and the vessels where the blood would go. Now we're going to talk about normal levels of cholesterol. Healthy levels of cholesterol by age is what I have up here. I'm not sure you can see everything, but for young people and as young as 19 to 20 years old, you should get a physical. Every 5 years, you should be getting your cholesterol checked, especially depending on what you're eating. If you visit and frequent McDonald's a lot, you need to have it checked because the fatty foods will tend to cause your cholesterol levels to go up. You see that there is a total cholesterol, that non-HDL, that's the triglycerides that I was talking to you about. The LDL and the HDL, that's the good and the bad cholesterol. You want those numbers to be within those ranges. Now, I wanted to share with you that if you have, say, look at the second box where it says men age 20 or older. If you had a 220 cholesterol, and your 220 cholesterol total was all you had, if you just had that number, that's not enough information. Just like if you were doing a math test and the math test gave you 5 answers, A, B, C, D, and E was not enough information. Really just getting a total cholesterol is not enough information because what you have is a ratio between the HDL and the LDL along with that non-HDL. So you want to get the breakout. So make sure that your doctor gives you a breakout so that you know what your LDL and HDL is. Let's move on to the next slide. All right, now let's talk about blood pressure. High blood pressure also refers to, you'll see it in your record sometimes as HBP, sometimes HBT. That is the force of blood, when you watch the blood go through the heart, into the lungs, come back from the lungs and go out, the force of blood has to be pushed to go out through that aorta. So when your force, the top number is called the systole. Systole, that's your top number. That's when the blood is pushed out through the heart to go to the rest of the body. That number is called the systole. The time that your heart rests, remember when it showed you the superior vena cava and the inferior vena cava, the time that your heart rests, the right atrium or the right side of your heart fills, and then it goes through the tricuspid and it fills the ventricle. It pushes back out. When it's filling, that's the diastole. The diastole is the lower number. Those numbers need to be between the numbers that you see to your right, which is 120 to 129. You're borderline high when you're getting 130 over 139. It's higher if it's high blood pressure if you have 140 over or higher. That's for the systole. And then you'll look at the diastole. If it's greater than 90, that's considered high blood pressure. Now, when you go to the doctor, each time you get a reading, when they do your blood pressure, if that number's up and you just had a argument with a spouse or you were told some bad news at your job and that number was high, that's to be expected. But if you have a consistency, more than 3 blood pressure readings in a 3 to 6 month period, then you have to be considered for high blood pressure. And you and your doctor should have a conversation about medications. All right, can we move forward? So we want to thank God for salvation. It helps you to understand some things that we need to stop doing and that we should not do that will increase the problems of pressure, elevated blood pressures. 1, obesity. So we have to watch the amount of food we eat. Now that we've been in a pandemic, I'm sure that some of our waistlines have increased more because we're not doing as much exercise. We really couldn't go to the gym. And we were sitting at home. We were doing more subtle jobs in front of the computer, and we would eat or tend to eat more. That's something you'd have to work on. Inactivity, I just talked about that. Alcohol, genetics, smoking. Some of these things are things that we actually have great control over. Genetics, not necessarily. You can't choose what family you come through. Low potassium or calcium or magnesium. Those issues can cause a problem. Stress. You will have to deal with working with your stress. The amount of salt. You should not put salt on everything. Had a wonderful meal this Easter that my son made me, and it was done with low sodium. He used thyme, rosemary, different spices, and there was no need for salt in the foods. Let's move our slides. I want to say one thing about the sodium. Sodium, for certain cultures, particularly African American cultures are very sensitive to sodium. So elevated sodium levels can increase blood pressures more rapidly in African Americans. Just wanted to add that point in. Now let's talk about reflux and GERD, as you've heard it maybe said before. Gastroesophageal reflux disease, or GERD, occurs when the stomach acid frequently flows back into our esophagus. And you can see that on your right, where the green is coming up, that's the acid. Now, the stomach acid, God made stomach acid about 1.5 to 3.5 so that we could break down proteins. We could break down other fatty foods, and then it could be distributed for nutrition into the body to go to the cells. There's a sphincter called the cardiac sphincter, where that acid is, if you remember, I know if you were 40 and above, when you used to go to the bank with your parents, they used to have these little coin purses that you could squeeze on the side. That's kind of what that sphincter looks like. And it stays shut unless it's stimulated. It would be stimulated by a bolus of food, or it could be stimulated by caffeine, sometimes stress. If this opens up before it's supposed to, that stomach acid comes up, creating what we call heartburn. Move the slides. I want to show you a picture of how the stomach works.
Gastroesophageal reflux disease, or GERD, is a condition that causes the burning sensation known as heartburn. When you swallow, food passes down your throat and through your esophagus or food tube to your stomach. A muscle called the lower esophageal sphincter controls the opening between the esophagus and the stomach. This muscle remains tightly closed except when you swallow food.
That's that cardiac sphincter.
When the sphincter fails to close, the acid-containing contents of the stomach can travel back up into the esophagus. This backward movement is called reflux. When stomach acid enters the lower part of the esophagus, it can produce a burning sensation commonly referred to as heartburn. Several factors might explain why this reflux action occurs. The most important are the following: the position of your body after eating. An upright posture helps prevent reflux. The size of the meal. Smaller meals reduce reflux. The nature of the foods you eat and drink. Certain substances that irritate the esophagus or weaken the sphincter can cause reflux.
Excellent. So how the stomach works, it's medications can help if you're having problems with reflux. Smaller meals help. Avoidance of excessive caffeine. If you notice, I've said that several times. So if you are a Starbucks king or queen, you have to keep that in mind, because that can trigger reflux, especially if you have a high stress job. If you love spicy foods, that also is a problem. Eating and laying down within a 3-hour period can be a problem. We cannot eat hot dogs with relish and things like that sitting in the bed, and then you lay down, because that stuff comes back up. That sphincter does not close. If you would notice, I'm not sure, but up to, let me see, I don't know whether you can see my marker, but here to here, stomach acid can be handled. When it gets past that area, that's when you start having problems with reflux or heartburn. Other things, after dinner mints can trigger heartburn if you have reflux. Peanut butter, chocolates because of caffeine. Let's move on. So I just wanted to show you things that can cause GERD: pregnancy, obesity. That's because you will put pressure, tight clothing. So if your pants or your belt buckles are really tight against your abdomen or stomach area, that tends to be like a pressure that's put across here, and it will give a negative pressure that will push this sphincter open, that cardiac sphincter open, and stomach acid will come through, causing you problems. Delayed stomach emptying, that's a problem. If you have a hiatal hernia or the stomach there's some muscles that come across here where your lungs sit here and the muscle comes across here. If there is a hiatal hernia, that muscle called the diaphragm, the singers know about that. It will push, some of that stomach will push through there. And when that happens, it will cause reflux. Next slide. Common symptoms that you will find is a burning sensation in your chest, usually after eating, and which can get worse at night. Chest pain, chest pain, chest pain. I'm saying this because just because you're having chest pain, don't think everything is gas. Yes, it could be, but if you are of the age of 40 or above, a female, especially African American females, it's not all gas. So you want to have that evaluated by a physician. Difficulty swallowing. If it feels like food is getting stuck in your throat in certain areas, you need to see your friendly ENT or a GI or gastroenterologist doctor. Regurgitation of food. If you are burping a lot and you get a sour taste in your mouth when you wake up in the morning, you experience hoarseness, that's down on the lower area, even feeling as though you're short of breath. A lot of people come to the ear, nose, and throat doctor about that, and what it is reflux. Sensation of a lump or a globus sensation, something sitting in the back of your throat. You want to go and see either an ENT doctor after you've seen your regular doctor, an ENT doctor, or your gastroenterologist. Let's move to the next slide. So, medications for cholesterol and blood pressure. Want to talk to you about those very quickly. Statins. Statins help with bringing your cholesterol down. However, those clear through the liver. So, if you don't know, I want you to make sure that your liver's checked every 3 months if you're on a cholesterol medicine. It should be checked. That's your doctor's responsibility. But what we are doing here on this platform, and I just feel God-led to do this, is to make you educated, help you to understand your body and what needs to be done so that they can help take better care of you. Every 3 months, have your liver checked. Every 3 months, have your kidney checked. Because for blood pressure problems, you may be on diuretics. That's water pills. The water pill, you will see it on your medications. If you've never seen it before, your medicine may say lisinopril /HCTZ. HCTZ is hydrochlorothiazide or HCTZ. Sometimes you may just have HCTZ. So with that, every 3 months, you want your liver checked, you want your kidneys checked. Other medications that are used for cholesterol would be fish oil, niacin, fibrates. Those are good. Now, what I want you to remember with niacin, when you start taking niacin, you may take it, it's bringing your cholesterol down, but you feel like you're having hot flashes. That's something that occurs with niacin. If your doctor doesn't tell you, you will know. Fibrates help to lower not only your your LDL, but it also lowers your triglycerides. That's that non-HDL, because you don't want that to be high. I think I talked about ACE inhibitors. They protect your kidneys. You want to have an ACE inhibitor. In African Americans, lower doses of ACE inhibitors are not as effective. So a 5 milligram dose of lisinopril may not be as helpful if you have high blood pressure. Now, if they give you 5 milligrams and it's mixed with HCTZ, you're actually getting 2 blood pressure medicines, so you're fine. If you're diabetic, and you have a blood pressure medicine, and you say, well, nothing's wrong with my blood pressure. They may give you like a 2.5 or 5 milligram. They're doing that to protect your kidney. That's just some gee whiz information. All right. Calcium channel blockers, they don't work as well. They work very well, but they don't slow the heart rate down. All right. Let's move on. This is the last slide that I'll talk to you about, and this one is concerning medications for GERD or reflux. If you go to a emergency room because you're having chest pain, my suggestion, if you are 40 and above and you're having chest pain and you don't really go to the doctor that often, I think you need to go get that checked out. Don't just start taking PPIs or proton pump inhibitors. Well, what's a PPI? I'm glad you asked me. That is for heartburn, peptic ulcers. If you're having the hoarseness, if you're having that globus sensation, you could take over-the-counter Prilosec, Nexium. Acifex is not over-the-counter. Protonix is not over-the-counter as of yet, but these medications can be helpful. However, you do not want to take them greater than 6 to 9 months. If your doctor has you on them for 6 to 9 months, that's fine. But don't go to Kroger or Walgreens or Walmart and start buying these and stay on them forever and ever. Amen, because they're making you better and you're continuing to do the habits that create this problem. Why? Another good question that you asked me. You don't want to do that because proton pump inhibitors block the acid. They also block your calcium. And so if you do that, then it makes for bone thinning. As we get chronologically matured, then it makes a problem because you can get what's called osteoporosis or bone thinning. There's a better medication that you can take. It's a histamine 2 receptor. That's for heartburn or reflux symptoms, gas. Also, I use it sometimes for a bad case of poison ivy. Sorry about that. A bad case of poison ivy. The only one that is out there or should be out there now is famotidine. Famotidine, that is Pepcid. Ranitidine or Zantac used to be out there. This should be off the market because it causes stomach cancer. If you are still on it and your doctor hasn't gotten the news, then you need to make sure that you let him know you would like to be switched from that to either famotidine or a short period of the proton pump inhibitor. Another good medication that is very safe is Gaviscon. Gaviscon. I use Gaviscon at night. Now, a lot of people don't like the taste of it, and that's if you use the liquid. However, I use the tablets so that I can help people with stomach acid that occurs at night. One good thing is stop eating late at night, stop laying down right after you eat. And 2, this medication builds like a foam barrier. So it blocks where that cardiac sphincter was. It blocks with a foam barrier to not let that acid creep through if that cardiac sphincter opens. At this point in time, I have shared with you as quickly as I possibly could information concerning both heart and stomach disorders. If there are any questions, I would be happy to answer them.
All righty, thank you. This has been great information for us in our community. And so we want to do what we always do, is we want to give virtual hand claps to our presenter on today. Just want to make sure. And so we do have some questions for you.
Okay, they can't be too hard now.
The first one is, when women have heart attacks or episodes, do we have the same symptoms as men? Do we feel it in our arm and not in our chest?
That's an excellent question. A lot of times you will feel heart pain or you will feel chest pain, and it goes to the left arm if you're a male. But for women and some men, you can have jaw pain, you can have neck pain, and you can have right arm pain. So yes, that is a good question. It's not always in the chest. That's why I was saying, if you have these problems, you're in that 40 range group, I would go get it checked out with an EKG, with a further evaluation. Sometimes if you're a little bit older, or let me say chronologically matured, say 50s and 60s, late 60s, then you want to make sure that you get that EKG and that they do cardiac enzymes. Once it's cleared, that's fine. Younger people, 20s, 25, 30, 35, younger people, most likely it is from the stomach. But if it persists, I would still get it checked out.
Okay. The next question is, over-the-counter inhibitors are not supposed to be used in lieu of medical treatment or for long periods of time. Is that correct?
What inhibitors are they talking about?
It's over-the-counter inhibitors. That was the question.
I don't know. That's the thing. I don't understand what they mean by inhibitors, because they're I talked about blood pressure medications. Are you talking about, if they're talking, let me do this. If you're talking about Prilosec, Nexium, over-the-counter medications, then no, I wouldn't do that more than a couple of weeks, and I'd go get checked out.
Okay. The other question is, you said that every 3 months we should have your liver and kidney checked if you are on cholesterol or high blood pressure medicine. Why is that?
The reason why is because cholesterol medicines clear through the liver. Diuretics clear through the kidney.
Oh, okay.
And so if you're not drinking enough water and you're taking a diuretic, especially if it's greater than 12.5 milligrams, like you're on a 25 milligram, you can dry out or dehydrate or dry out your kidneys, which can cause problems. If you work, like, I don't give diuretics to construction workers. I just don't. If you're a construction worker and you work outside, I'm not going to give you a diuretic because you may not drink enough water to support that medication. I'd try something else with you first. Now, if it's somebody that I know is really in tune with their body, like they work out and all of that, and they're going to do it, yes, I would. The liver issue, statins clear through the liver, and if you run up your liver enzymes, I know that our platform is for COGIC, Church of God in Christ, but for those that are not Church of God in Christ, if you drink alcohol and you're taking a statin, you can be affecting your liver. You're working your liver really hard. That's a problem. So you should get that checked every 3 months. Most doctors know to do that.
So one of the things that I've heard people say is that some of the high blood pressure standards are not the same, or should be different for the African American community.
Say the question again.
The high blood pressure standards, like the 140/90, I've heard people say that's not relevant for the African American community. That should be something different.
The numbers that I showed you are effective. That's the right ones. What we try to do is go 140/90, but if you're at that 130 over 130 to 139, and from 80 to 90. In that range, you want to keep the numbers down from that. It's something to look for. Be concerned if you're staying up over those numbers. Watch the amount of salt intake you have.
Okay. Chair Lady Allen has asked, an African American female 40 plus experiencing acid reflux when fasting over 10 hours. Should this be a cause for concern?
It should. If there is a chronic problem with that, I would actually go and see a GI doctor. If we're talking about the fasting that we do as saints, yes, you want to watch out on the amount of caffeine that you're drinking. You want to watch out on the amount of, after you come off of a fast, doing a lot of caffeine, a lot of chocolates, peppermints, peanut butter, onions, spicy foods. It's not a good idea to come off of a fast and do those type foods right away. You want to have more alkaline type foods. Hopefully that answered her question.
Yes, thank you. Next question. Is there a real danger of mercury when taking fish oils for high blood pressure?
It is. It is. That's why you have to look at the labels. I'm not sure whether I should advertise for people, but the Nature Valley or something like that. That's a fairly good one, pretty clean. But you should research that on your own for where you're getting it from.
All right. Do we have one more question? Are leg cramps a sign of dry kidneys when taking water pills?
Amen. And how you can fix that? Gatorade, all sport. I do that all the time. I also tell people that when they're taking a diuretic, to utilize about 8 ounces of Gatorade or all sport 2 to 3 times a week, and make sure you're drinking plenty of water. But yes, leg cramps are a sign that your diuretic is doing a number on you.
Okay. All right. I think that wraps it up for our questions on today. I had one other question. You said that most of the stomach symptoms we talked about, maybe heart conditions or the GERD. Are there any other conditions that we should be looking out for or talk to our doctors about if we're having these stomach problems?
Yes. If you once you get checked out and you find out it's not your heart,
Okay.
that's what I was hopefully I was trying to convey it in that manner.
Yes.
What I didn't want people to do is 40 and above keep taking Tums and Rolaids and thinking they're okay when those are signs of a possible heart blockage. When I showed you the vessels coming out, going to the head and going to the legs, there are vessels. All the blood in your body goes into your heart. But that's not what supplies your heart. What supplies your heart are the vessels on the outside of that heart. Those vessels, if they get blocked up, that's what causes an MI or myocardial infarction, heart attack. It's the vessels on the outside. If those get blocked up, that's a problem. And one of the signs is the pain in the chest, pain in the heart, pain in the neck, then you can go, I've had patients go to the dentist, get checked out. It's nothing wrong with their tooth. And the first thing that I do when they come in to see me, they tell me they saw the dentist, I get straight. When I was in internal medicine, do an EKG and start working up their heart.
Wow.
Oh, I see another question. I'm going to say this real quick.
Okay.
Yes, I do recommend mustard. There are some people that don't like to take medications, and I will tell them to do a teaspoon twice a day of yellow mustard to help with reflux intermittently. However, if that does not help, and you're taking a bottle of mustard a month, then you need to go see a doctor.
Okay. Wonderful, wonderful. So let's thank Evangelist Johnson again, for this is life-saving information, very relevant to our communities. And I will definitely, follow up, because I know many people that take high blood pressure medicine and cholesterol medicine, and I know they're not having their liver or kidney checked at the
Well,
rate
they may be, but see, this is what I want us to do.
Right.
Be responsible for our own care. You understand what I'm saying? The doctor's supposed to send you a letter every 3 months, come in and get your blood. Well, if they send you a letter and you take it and throw it over in the pile of letters that you have with bills and stuff and don't pay attention to it, and then go and see them, that's not their responsibility. It's about you and your protoplasm. You think about you. If they send you a letter, get in there and get that blood work done.
Looks like we have another question for you, Evangelist. Are there any places to inquire after when seeking instructions on how to cook foods or recipes with low sodium?
Oh, there is a website, All Recipes, you can go to, and you can look at that. But I'm not saying I'm not the greatest cook anyway, but I do a lot of air frying now, and I buy food in bulk and season with different seasons, but I look at labels to make sure it doesn't have a lot of sodium in it. Another thing, those of you that are single and like to just, especially men, like to just get those Swanson dinners, please look at those Swanson dinners and look at how much sodium is in there, because it's an awful lot.
Wow. Okay. Well, we're going to thank you again for all of this wonderful information. Definitely life-saving, and helps will give us the ability to, really check our health and know how to have conversations with our healthcare providers.
Right.
And now we'll be on a little bit more alert when we find ourselves burping a little bit too much, or eating all of that chocolate or that caffeine. I mean, I didn't know that
and
about
hoarseness.
Hoarseness.
Yes. I'm going to say my seniors, 65 and above, when you start noticing that your voice is going down lower, that you don't have the strength, for my singers that are not singing as well or can't hit notes, come see your friendly ENT about your voice, and then we'll probably end up treating some reflux. And let's watch our weight. Weight is a big thing for both the heart and the stomach.
Absolutely. Absolutely. Well, we want to thank you so much again. Thank all of you for your participation on today and your engagement with Evangelist Johnson. Next week, we'll be having the importance of prayer and fasting with Lady Yvonne Atkins. She is our International Sunday School Department AIM 7 a.m. prayer leader. We thank you again for joining us on #PowerUp, and we'll see you next time.
All right.
All right.
Thanks for having me.